Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, Doctor of Nursing Practice, Family Nurse Practitioner, and owner of Wells Legacy Health and Wellness. So excited to be here with you tonight to discuss another important and amazing topic that I think we all need to be aware of that we don't necessarily think of until something happens. Last week we discussed colon cancer awareness, and as you know, March is colon cancer awareness month. So if you have not watched the live from last week, go ahead and check it out. If you have not had your colonoscopy and it's your time and you're around that age 45, or if you have a family history of colon cancer, it's time to schedule your screening. So go ahead and get that scheduled. Tonight, we're going to be discussing brain injuries. Brain injury awareness is in the month of March, as well as several other important health topics. And so I thought it fitting to discuss this topic tonight, being as if we're in spring. There's many individuals who have spring sports going on. There's a lot of spring breaking happening. Individuals are swimming, taking trips in cars, doing all the things, having fun. And so tonight we're going to delve into brain injury awareness and some things that I feel like you all need to know. Having been someone who's had a concussion, it's not fun. And my daughter, if many of you don't know, she played volleyball at the illustrious Howard University. Go HU. My husband and I are honorary Howard University students and alumni because of our daughter. No, just kidding. We'll leave that designation up to her. But having had someone and a child who played volleyball for many years, it wasn't until she played at the collegiate level that she experienced concussions, and she had two pretty bad concussions. And we're going to talk about that a little later. But tonight, what we're going to do is we're going to talk about concussions and some other brain injuries that individuals may experience or, have because of different injuries. And so tonight, with concussions, concussion is considered to be a mild traumatic brain injury. There's different levels of concussion and different stages of concussion. And so it just depends on how hard the hit is, how hard the fall, or what have you, or the impact to the head will determine the different degrees of the concussion that an individual has, as well as the symptoms that they may experience. But some of the common symptoms that an individual may experience with concussions is confusion, headaches, dizziness, nausea, sensitivity to light, not being able to focus or concentrate on things such as their phone or their tablets. And so it's important that we follow some strict rules with individuals who have concussions. And essentially, what is a concussion? A concussion is essentially bruising to the brain. And so what happens is when an individual is hit, the brain will shift and there will be some irritation or bruising to the brain, which will then potentially cause some swelling to some degree or irritation to that part of the brain, which then will cause that individual to have a concussion. Most of the times when we see car accidents and individuals who suffer from whiplash, from that jarring motion when they get hit from behind or from the side, or they hit something in front of them and their head does this quick back and forth motion, the brain is essentially sloshing around in the head. And if you know that your cranium or your skull is hard, and so if that brain begins to shift around, it could cause some issues. And so essentially that is what a concussion is. What are some I just talked about one of the causes of concussions or methods in which someone can sustain a concussion, but another common way that an individual can sustain a concussion is sports. Our daughter played volleyball from the time she was in elementary school. She went from elementary school playing at the local community Baptist church at Windermere with Upward, and then she went on to play in middle school, high school, club volleyball, and then she went on to play at the collegiate level. With our experience with volleyball, and I played basketball, I ran track, I played volleyball. Never did I sustain a concussion. I wasn't as gung ho as some of these young ladies and men are who are playing now. But I never sustained a concussion until 2023, I believe it was, and we'll talk about that. Um, some accidents and hazards that could cause head injuries, which is what I sustained. But with her, she was a middle blocker, as you all know. She was number 14 at Howard University. Um, and she was hit in the head with ball twice. Well, several times, but 2 times it really caused her to develop some severe symptoms, and she was diagnosed with a concussion. And I'm gonna leave that part out. She's doing well. She did fine. It took some extra attention from her mommy, nurse practitioner, Dr. Wells, in order to get her where she needed to be, and to have to advocate for her, which I felt like we should not have necessarily had to do. But thank goodness and thank God that I have the knowledge that I do, that I was able to advocate for her and get her the care that she needed. When you have individuals who have certain illnesses or conditions or suffer from certain things such as migraine headaches with auras, there's different type of migraines, and we'll talk about that at some point later. But my daughter and I both have a history of migraines with auras, and she had become very frustrated in that her symptoms were not resolving in a timely manner. They kind of prolonged and played out longer than we anticipated. And after much consulting and talking with our neurologist and repeat visits with the team neurologist at Howard University Hospital, we were able to determine that because of her history with migraines with auras, it was going to take her a little longer to rebound from the migraines. And so much so, poor thing, on her 21st birthday, she was suffering from a concussion. And it was just devastating for her. And it was hard to see her like that. We flew to DC to be there with her and for her birthday, and we spent majority of the time with her in a dark room and just kind of coddling her and helping her to recover. So sports, falls, accidents, injuries to the head can cause them. One of the I sustained a concussion, and it was from a bar falling and hitting me on the head while I was working out. So we have to be careful when we're working out, when we're doing different things, that we don't have hazards in the way that could cause us to experience some issues. And so you have the mild concussion, which I talked about, which causes the confusion, the headaches, the dizziness, the nausea, can be caused from sports, falls, or car accident. Traumatic brain injuries, more severe than concussions, can cause long-term issues such as memory loss, personality changes, difficulty concentrating. And so traumatic brain injuries, again, can come from accidents, from falls, from blunt force trauma to the head, from, other accidents that cause, severe damage to the individual's head. And typically there's some skull fractures that happen with this. There's a lack of oxygen that could happen, anoxic brain injuries, so forth. And so it's important that we know the signs. And if someone does sustain a head injury, that we get them emergency care as soon as possible. We've heard in the news many cases of individuals sustaining a fall and hitting their head and going home and going to sleep and not waking up, because during the night at some point their brain swelled and caused them some issues and they did not survive it. So it's so important that we pay attention to the signs and symptoms. And if someone does sustain a head injury, that we monitor them and get them emergency care as quick as possible. So with the traumatic brain injuries, they look different. You see, I can't tell you how many times I've seen on TikTok and on social media some of these young individuals who are driving their cars pretty fast or get into an accident and sustain traumatic brain injuries and are left in a semi-comatose state, or have anoxic brain injuries where their brain was deprived of oxygen because of the accident or injury, or positional after they got into an accident. And so now they are faced with lifelong challenges with their health and rehab that they have to go through. So the next thing we're going to talk about is stroke related brain injuries. As you know, we talked about strokes during the Heart Health Month, and there's a Stroke Awareness Month. We'll kind of discuss that as well. But knowing the signs and symptoms of a stroke, it's caused by lack of oxygen to the brain, essentially, which can mimic the traumatic brain injuries that are caused by anoxic brain injuries, which is lack of oxygen to the brain. However, strokes, the cause of the stroke is completely different than that of traumatic brain injury. So essentially, when an individual has a stroke and there's lack of blood flow, there's a blood clot or a blood clot or plaque that has broken off and gone and obstructed a major blood vessel that's carrying blood flow to that brain, and it's caused part of the brain to die. And so they've had a stroke, and now they have some deficiency because there's lack of blood flow to the brain, which causes death to that part of the brain. So it's definitely more severe than a concussion, and it definitely causes some additional symptoms. It can lead to paralysis, speech issues, cognitive impairment. So these individuals may or may not have issues with one part of the body or one side of the body or both sides of the body, depending upon how severe the stroke is and what part of the brain is impacted. It can lead to speech issues if that individual's stroke occurred in the Broca's center of the brain, which is the speech center of the brain. Broca, B-R-O-C-A, Broca's center of the brain, which can cause issues with speech. These individuals may have aphasia where they're not able to speak. They're not able to completely express verbally what they're feeling, what they're going through. Sometimes they do rebound. It depends on the severity of the stroke and the exact area of the brain that was impacted. But with speech therapy, with time, with therapy in and of itself, and given the brain time to heal, these individuals may regain their ability to speak. Their speech may sound a little differently, but sometimes individuals are able to rebound from that. And then cognitive impairment. So they may forget or not be able to, balance their account anymore, or remember passwords, or do things that we typically don't even think about doing, like tying your shoe or getting yourself dressed, depending upon, again, the type of stroke and the area that was impacted. If you've ever seen someone who's had a stroke, you may see the impact of the stroke and how it's impacted that individual. So what are some of the signs and symptoms that we want to discuss when it comes to brain injuries, and recognizing the symptoms and knowing that it's important to be aware? So physical symptoms of brain injuries could be headaches, dizziness, blurred vision, or nausea. Some of the cognitive symptoms could be memory loss, difficulty concentrating, or confusion. Emotional symptoms could be mood swings, depression, and anxiety. We see these mostly in individuals who have had severe concussion, and when I'm speaking of the emotional symptoms, severe concussions, traumatic brain injuries, or brain injuries from stroke. You will see the changes in there. You may see changes in that individual's mood, anxiety, depression, and then mood swings. When should an individual seek medical help? If the headache persists and they don't go away, if it's categorized as the worst headache an individual has ever had, we want them to go in and get medical care. If they lost consciousness, even if it's very briefly, we want them to go in. If they're vomiting, they have seizures or extreme confusion, we want to make sure that they go in and get medical care, because that's signs and symptoms of swelling of the brain, or some additional increased damage to that individual's brain. So what are some things that we can do to prevent brain injuries? If you're someone that rides bikes, and many times we see, I can't tell you, the year that the law was changed in Florida, where individuals did not have to wear a helmet while they were riding on a motorcycle, we saw a significant increase in traumatic brain injuries and anoxic brain injuries because of motorcycle accidents. The deaths shot through the roof. And then young individuals who were enjoying motorcycles and not wearing helmets. And I still cringe to this day when I see individuals on motorcycles without a helmet, because the injuries just went up. So when you're riding a bike, sports bikes, skateboarding, or motorcycles, make sure you're wearing a helmet. It reduces the risk of brain injury or brain incidents, head injuries by 85%. 85%. If you're driving in a car, use your seatbelt every time you drive. It prevents 50% of head injuries in the event that there's a car crash. 50%. Falls prevention for seniors or anybody, for that matter, individuals who are at risk for falling, who have issues with their balance, or there's a lot of clutter around. Just do what you can do to surveillance your area to make sure that there are no fall habits, no toys on the ground. Those who have pets, make sure you're picking up behind your pets and that their toys aren't around. If you're an individual that loves rugs, make sure you have that anti-slip protection underneath, because falls can happen and in the home, and it's things that we've been around the entire time that we've been in our home, and we don't pay attention to it. So remove the hazards, remove the rugs if they become a hazard, remove the clutter to ensure that if you're getting up at night to go to the restroom, or you have to get up in the morning and it's dark, to ensure that you're not tripping and falling over things. And if you have stairs in your home, make sure that the stairs are well lit and that there's a handrail. And if you are having issues going up and down the stairs, that you are utilizing the handrail and that you are taking time and caution to go up. So what are some things that we can do in terms of screening? And then we'll talk about some recovery from the brain injuries. Screening just depends on the type of brain injury. So there'll be a neurological exam. And when I say neurological exam, we're going to ask you certain questions. Any numbness, tingling, pins and needle sensations in your hands or feet, any confusion, any issues, headaches, blurred vision, double vision, what have you. May ask some additional questions, asking you to remember certain words, draw a picture, or what have you. Different things that we can do to assess your neurological status. There may be some imaging, CT scans or MRI, depending upon the type of injury sustained. Cognitive testing for memory and problem solving. So you may be asked to multiply and divide and subtract some numbers to see where you are cognitively. Recovery, again, is going to depend on the type of injury. Physical therapy, occupational therapy, and speech therapy are all types of therapy that an individual who suffers a traumatic brain injury or head injury in and of itself can benefit from. Cognitive rehab, such as brain exercises to ensure that you're rebuilding the brain function, and then lifestyle changes. So proper sleep hygiene, nutrition, and brain boosting activities. Some of the things that we can do are so simple, and it's making sure that we utilize the tools that we have at hand or at our reach to protect us. The helmets, removing the clutter from our homes, removing the rugs, making sure that you're going up and down the stairs and that you can get up and down stairs safely. And if you're driving in a car, utilizing your seatbelt, as well as wearing a helmet. If you're driving a motorcycle, if you are riding on a bicycle, do what you need to do to make sure that you're taking care of yourself. Some of the things that I want you to take away from this session tonight is that brain injuries are more common than we think. We think, oh, can't happen to me. It happened to me. I sustained a concussion. And while it was a mild concussion, I had some very serious side effects, and they lasted longer than anticipated. Prevention can save a life and improve long-term health outcomes. And if you or someone you know have any of these symptoms, we want to make sure that you get checked. Protect your brain, wear a helmet, buckle up, take falls seriously. I want to make sure that we are doing what we can to ensure that we are safe and that we have the tools that we need. This has been a brief talk tonight, but I found it to be very timely for where we are right now. And one thing I want to put out there is be careful of individuals who don't know how to swim around water. Make sure that you're putting water safety things into place, and make sure that you know how to perform CPR in the event that there is an injury or accident with someone and they stop breathing. If you don't now know, I'm putting a shameless plug out there. If you don't know how to perform CPR, reach out to us. We offer some free classes to our community. If you have an organization or if you need certification for your work, reach out to us. We can get you certified. But if you don't know CPR and you or family or in a group of friends would like to get together to learn friends and family CPR, reach out to me. We do offer a certain amount of free courses throughout the year. So this is your opportunity. This has been Dr. Latoya Wells with Wells Legacy Health and Wellness. Stay safe and be well. We have been approved for some insurances. So if you have insurance and you'd like to know if we accept your insurance, reach out to us, 321-306-6755, or you can check us out on the website. We are also expanding our services to include medical weight loss, male and female hormone replacement. So if you know of someone or if you yourself are in need of those services, check us out. Stay safe and be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Until next time, we'll see you later. Bye.